Katie Zuber. I'm Assistant Director for Policy and Research at the Rockefeller Institute of Government, and I'm also the Executive Director for the Center for Law and Policy Solutions. So I'm working on a couple of different projects, both with the Institute and through the Center. I think some of the most interesting research I've done is looking at an in-depth study of the opioid crisis. I'm working on this project with Patty Strock, who's the Director for Policy and Research at the Rockefeller Institute of Government, and Elizabeth Perez-Chiquez, who is one of our visiting fellows. And so the opioid epidemic has been declared a public health emergency, but it's often experienced by and addressed by local communities. So basically what we want to know, how do opioids affect local communities? What are local communities doing to respond? And what do they need from state and federal government officials in order to be able to more effectively understand the problem? Well, we started this research back in November of 2017 in Sullivan County, which is a small upstate rural community about an hour and 20 minutes or so outside of New York City, and we are expanding our research into some of the surrounding suburban and urban counties. We have conducted over 115 interviews. We're actually getting ready to go back to Sullivan and Orange counties next week. We've attended numerous task force meetings and community events, and we've also toured 2 of the rehabilitation facilities and treatment centers in Sullivan County. So that experience, just being on the ground, on the front lines of the epidemic, has been really eye-opening. Also, as the Director for the Center for Law and Policy Solutions, I'm also responsible for the development and oversight of an undergraduate internship program. This particular program is unique in that undergraduate students from the University at Albany can receive both credit and financial assistance for their work as undergraduate policy interns. So it's really about giving students hands-on experience using data and evidence to inform the development of good public policy. Our initial cohort, which started in, I believe, the spring of 2018, did an examination of drug treatment courts as an alternative to incarceration in the context of the opioid epidemic. The latest cohort in fall 2019 basically explored what would happen to women's reproductive freedom and access in New York State in the event that there was a reversal of Roe v. Wade. And currently I have students who are doing an examination of post-secondary correctional education in New York State to kind of get a better understanding of how college and prison programs operate in New York State and what the SUNY system in general can do in order to contribute to the development and expansion of these programs. So the internship is really useful for giving students an opportunity to study these important social justice issues through the lens of public policy and analysis. I think one of the hallmarks that is consistent across both of those projects and both of those endeavors is this bottom-up approach to understanding politics. So I think by taking this bottom-up approach to understanding issues like the opioid crisis, we can help inform policymakers and the general public about the true nature of the problems that they seek to address. And so one of the interesting things that actually comes out of our research on the opioid epidemic is that well-intentioned policies that are designed to actually ameliorate the opioid crisis can in fact make it worse. So it's this idea that in order to make effective public policy, people have to know and understand the true nature of a problem. When we went down to Sullivan County, we had no idea what to expect, but just through casual conversations with people at the dining room table, over a cup of coffee, in their living rooms, at their offices, we came to learn so much about the epidemic. What's really interesting to us is that the things that seemed obvious to people on the front lines, things like transportation, a lack of transportation making it difficult, not just to get to treatment, but to get to the grocery store or to pick up a prescription, those things which were obvious to people on the ground were really surprising to us. And so it's been really interesting to learn from people on the front lines about their experiences and how those particular experiences can be used to inform the development of policy. Sometimes, so we will be, I mentioned we've done over 115 interviews, and sometimes Patty and Elizabeth and I will be driving in the car talking about an interview, dissecting a particular insight or observation, and we'll just kind of look at each other and say to ourselves, man, you can't believe we actually get paid to do this kind of stuff. So that's a rewarding experience. One of the things I enjoy most is teaching young people about the inner workings of the political system. So in addition to working with the CLPS interns, I've also taught undergraduate courses in American politics and public law. And it's very easy to have an opinion about politics, and I really try to encourage students to think critically about political phenomenon using the tools and paradigms of political science to kind of guide their work. So it has been really interesting and really rewarding to work with students, especially from the center, and to see when the light bulb kind of goes off and they begin to start thinking differently and more critically about the American political system and how it operates. And it really never ceases to amaze me, the amazing things that undergraduate students can do, especially when there's only 2 or 3 weeks left in the semester. They are very capable of pulling things off. And so that has been really rewarding to work with a group of students who I think, and I hope in turn, will go out and pay that work forward.